Namaste, Dr. Divya here. So in today's session, we are going to study about the neurological disorder, which is all about the hearing impairment. So let's begin the session. So the hearing loss. Hearing loss that comes on a little by little as you age and also known as the presbycusis is common, which is the more than half the people in the United States older than age 75 have some age related hearing loss. There are the three types of hearing loss which you can find in the medical terms as well. The conducive, which involves outer or the middle ear, and also the sensory neural, which involves the inner ear, and the third one is the mixed, which is a mix of the two. Aging and being around loud noises both can cause hearing loss. Both can cause the hearing loss, and also there are other factors such as too much of earwax and can lower how well the ear works for at a time. So what are the symptoms for the hearing loss? Symptoms for the hearing loss may include that the muffling of the speech and other sounds as well, trouble understanding the words, especially when in a crowd or in a noisy place, trouble hearing the letters of the alphabets that are not the vowels, and along with that, the often asking others to speak more slowly and clearly and loudly as well. Needing to turn up the volume of the television or the radio, and also staying clear of some of the social settings. Being bothered by the background noise is also one of the symptoms you can find in a lot of people that represents the hearing loss. Ringing in the ears known as the tinnitus also is one of the things is going here. How hearing loss can occur? So the causes of the hearing loss includes the damage of the inner ear, definitely. Aging and loud noises can cause wear and tear on the hair or nerve cells in the cochlea that sends the sound signals to the brain. Damaged or missing hair or nerve cells which actually don't send the electrical signals well. This causes the hearing loss. Higher pitched tones may seem muffled also. It may be hard to pick up the words against the background noises. Build up of the earwax. Over time, the earwax can block the ear canal and keep the sound waves from passing through. Earwax removed can help to restore hearing. You can find in lot of people the earwax in the older age, it becomes continuous. So the doctor said, okay, you have to remove it. Ear infection also. And in the outer or the middle ear, any of these can cause the hearing loss. The ruptured eardrum also is also known as the tympanic membrane perforation, and also loud blast of the noises, sudden changes in the pressure, poking an eardrum with an object, and infection can cause the eardrum to burst. So what are the risk factors behind it? Factors that damage or lead to the loss of the hair or the nerve cells, the inner ear include aging, loud noise, hereditary, noises on the job or the things, noises at play, and some medicines, some illness. So these are the terminologies in that. What are the prevention? The following steps can help to prevent the hearing loss from loud noises and keep hearing loss from aging from getting worse. So protect your ears. Staying away from the loud noise is the best protection. In the workplace, plastic, the earplugs or the glycerin filled ear muffs can help to protect from the hearing. Have you ever hearing tested? If you work around a lot of noise, okay, think about regular hearing test. If you work in a industrial area like this, if you have lost some hearing, you can take the steps to prevent further loss. Avoid risk from hobbies and play. Riding a snowmobile or a jet sky, hunting using power tools, or listening to rock concerts can damage hearing over time. Wearing hearing protectors from taking breaks from the noise can protect your ears. Turning down the volume when listening to the music helps too. So there are a lot of practices which helps. So I always suggest that the stress reduction and also the auditory well-being practices. For example, in yoga practices, yoga therapy, Makarasana is also called as a crocodile pose. You can do it. Vipreet Karni Asana, as also it is a remedial pose. It circulates the blood to every part of the body, and hence it elevate any illness included the tinnitus from the body. Adhomukh Swanasana also improve the blood circulation in the ear. The practices which actually represents the forward bending. It also helps. Enhanced focus and auditory processing. Having enough blood flow is essential for the performance or hearing systems. Poses such as the cobra pose, forward bend can increase the blood flow, possibly leading to better hearing health. Adding yoga to daily routine can also be the beneficial part of the overall well-being. Okay, and also there are a lot of other practices, for example, those practices which helpful for the balancing of the autonomic nervous system, which plays actually an important role in regulating the various bodily functions, including those related to hearing. You can activate the parasympathetic nervous system through various yoga practices also, like gentle movements and also the deep breathing exercise. For example, you can practicing the Nadi Shodhan Pranayam, which reducing the stress and promoting the relaxation as well. Yoga practices such as the alternative nostril breathing, which is called as same as Nadi Shodhan Pranayam, which aims to balance the autonomic nervous system. This autonomic nervous system, if it balance, it may contribute to the more stable environment for the auditory function. And also the many research papers show that the kumbhak including in the pranayam. So in the kumbhak what happens, it's a mainly respiratory exercise in which yogasan one of to exhale air from the lungs and also for the long duration with maximum capacity. Therefore what happens in that, the increases of the carbon dioxide in the blood, leading to the stimulation and regeneration of the hearing area. One of the best practice I must recommend to everybody for the hearing patients, Bhramari Pranayam. Bhramari is one of the most wonderful practice and also one of the best pranayam for the hearing patients, which can you practice today, and it is also called the bee breath. This pranayam mainly works on the ear, nose and the throat. While doing this pranayam, you have to make the sound that emulates like a humming bee, okay, through the throat, and also moreover you need to keep the thumb on the cartilage of the ear or the index finger you can put it. This create an echo inside the ear. And this pranayam is extremely beneficial for the tinnitus and also the sensorineural hearing loss. The same also stimulates the hair cells inside the ears. This kind of stimulation leads to the generation of electrical impulses that improves hearing. It is also unclogs the sinuses and the blocked ears. You can start this pranayam or the breathing exercise while sitting in any type of meditative asana. And also I always recommend to practice in yoga, especially the sattvic diet. Sattvic diet, which includes the carbohydrates, pulses and proteins, fresh green leafy vegetables and natural sweeteners such as honey and little bit herbs you can take, which is natural. So these type of things you can have it in form of yoga diet. And one thing you should remember, if anybody is undergone from the surgery part, Do not practice like Jalniti and any kind of these things, but if you want to, you can practice Jalniti is also one of the good practice, and if you want to practice more, you can practice Sutra Niti, which is the best, one of the best cleansing practice for the hearing patients. But yes, always be remember of the contraindication first, that if the people undergone the surgery or any kind of around surgery for the 6 to the past 1 year, so please do not recommend them only those persons, those who are undergone from the hearing loss. And if the age is increased, you can just tell them to learn Jalneti, then also it's fine, and other than all these pranayam and the yogasanas practice. Thank you so much for joining this session.